Hi, I teach. That's my superpower. Welcome to HETV, where we do all education for health, nurses, and everything in between. Well, today it's telemetry. And some of you have already purchased handouts, or you touched the link at the bottom to get the wonderful handout for today's educational session. So this is the handout that you would need. And I want you to pay close attention to 2 pages. The front page is huge. If you're in my program, you know that we put a big stock on prioritization and which EKGs to see first, second, third, and whatever else. But then also, I want to show you something. I like how, if you're smart, you paid attention to the picture of the actual EKG complex. And if you become systematic in how you take notes, this will become a lot easier. So you see the P wave is blue, the R is yellow, the T is pink, and there's these not as significant Q and S because it's so hard to see them. But I'm gonna kind of put that really close to you and see if you could see that. And then if you look here, I did it again. I did the blue P, I did the yellow R, I did the pink T. That's the key. Get systematic in how you do this. And of course, the Q and the S's are down here, okay? So we're gonna do a lot with this. So let's just be really clear. I know that many people confuse telemetry with EKG. So let's separate the two. First of all, when you think of telemetry, and I work on a telemetry unit, so it's near and dear to my heart that you understand the differences. Telemetry is very general. It's just looking at, generally speaking, what is this patient's heart doing over time. When you think of an EKG, it's extremely specific. It is hoping to capture a problem that the patient is having right now. So for telemetry monitoring, there doesn't have to be a suspicion of a problem right now. It could be as simple as this patient has had a history of some cardiac problems or some events in the past that make the physician or the nurse practitioner very concerned that what's going on today might impact that heart again. With an EKG, we worry, suspect, are extremely concerned that there may be indeed an event right now. So it's more specific. The other issue is that telemetry is continuous. The monitor must continuously stay on. The leads cannot fall off. The battery can't die. It is our responsibility as nurses, both LPNs and RNs, to assure that the telemetry monitoring is continuous. And we also have a wonderful unit that usually backs us up. It's a unit sometimes not even on the hospital property where we're working as RNs and LPNs, that their sole purpose is to be our backup. And it's important to know that they're a team player in this. They're our friends. Yes, we get agitated and aggravated when they call us. Are you a nurse? Well, the patient's telemetry in room 12 is off. And you're just like, OMG. They keep pulling it off. Or, oh my God, seriously, she's in the shower. Or seriously, they're down at radiology. Well, guess what? It's our responsibility to pause the tele monitor. And I've been guilty as charged because I don't always pause the tele monitor. So anyway, the bottom line is the telemetry is very general, very continuous. And when we look at telemetry, the whole purpose of it is for monitoring. That's not true about the EKG. The EKG is super specific, and the whole purpose of it is actually to diagnose. It's not continuous. It's a one-time event capturing the heart. At this point, what is it doing? And of course, it's for diagnosis. Now, so I hope that helped, because Too many people confuse these two procedures to be one, and it's not true. So if I say, oh, the patient was admitted and they need continuous heart monitoring, then you know that does not mean an EKG tech is going to be in that patient's room continuously. That would be telemetry. And it is very important that nurses know this. And I got to tell you, LPNs, you are way more involved in telemetry than most people think. So LPNs and RNs need to focus on telemetry and EKGs. And today, I really hope that you get a lot out of this educational experience, because we're going to cover everything. We're going to cover, for example, what to do with VFib. We're going to cover what to do with VTAC. We're going to cover how to recognize and what to do with PVCs. And what about torsades, something very few nurses really remember or even know about. We're going to cover some of the medications that we give. We're going to cover AFib and AFlutter. We're going to look at supraventricular tachycardia, SVTs. We're going to talk about tachycardia versus bradycardia. And then we're also going to talk about those heart blocks that you just love so much. That's what they're called, heart block. We're going to also examine other rhythms that are just very special for you to separate from everything I just said, including asystole and pulseless electrical activity, or PEAs. That is very important that you kind of know a lot about what to do and what not to do with asystole and PEA. Hopefully this lecture will go in such a way that every single person understands it, even some patients. But for sure, nurses, this is the target audience. So, oh, and if you're a nursing student, you know I got you, right? You know I got you. This is it right here. Now, so we're going to get started, and hopefully you'll get something out of it. Talk to you in a minute.